Hi everyone, this video is about plantar response. Many people actually misunderstands between the Babinski sign and the plantar response. Actually, Babinski sign is one of the important key feature to distinguish between the UMN lesion and the LMN lesion, upper motor neuron lesion and lower motor neuron lesion. Of course, but for that, actually, we have to check plantar response. Not actually the Babinski sign and the plantar response are not actually the same. Now I'll explain that. You take your knee hammer. If you remove this, we will get this sharp edge at the other end. Okay? Take a sharp edge like this. Just try to stroke the foot region. That means plantar region of the foot from the ball of the foot to the lateral side and then to reach the base of the first first grade toe from here to here. I mean, the ball means from the calcaneal region to the lateral side, and then to the drag from lateral side to the medial side, and then to reach the base of the first toe. Here, the ball of the first toe. It's like this. So now what he did was just actually he did flexion of all the fingers. Okay, you have to the interpretation here is see, just again I'll show you. Can you see? You should not go for more than 2 or 3 times. Okay, that will be accommodation, and you will not get good sign of response. Okay. Now what we have seen here is the plantar response. Plantar response means what we are actually trying to get out of the plantar surface of the foot is called plantar response. Okay. I try to make a stroke from the ball of the foot to the lateral side and then deviate it to the medial side to reach the base of the first grade toe. From that, actually, I got flexion of all the fingers. So the interpretation now is 3 things we have to understand from here. If you have UFN lesion, actually your great toe will go for extension and then all the other toes will go for fanning out. Extension plus fanning out. Okay, that is for UFN lesion. If you have LMN lesion, you will not get any response from this. There is no response. If you stroke now and then 2 times or 3 times, many multiple times, you will not receive any kind of response from here because your sensory may be affected, and your response, actually the reception of the sensory from the foot region to the spinal cord region, that is affected because the lower motor neuron, which is actually connected from your foot to the spinal cord, that is affected. So there is no impulses carried over from here to the spinal cord. So you are not able to get any response. Sometimes if you are able to get, suppose if the injury is not that much affected, you may get very minimal response. So that we can say this response may be absent or mild or very sluggish response we can see. Many times it will be absent only. Okay. Then if you have a flexion of all the toes, that means that is normal. For normal individuals, we will be having flexion of all the toes. So now we try to summarize this. If you have UMN lesion, you will have grade of extension plus fanning out of all the digits. Now we have LMN lesion, we have sluggish or absent or minimal response, poor response from the maximum, it will be absent only, no response, or sometimes if it is there, very minimally the response will be there. And suppose if the patient is normal, there is no lesion, there is no human or no LMN, it is normal. That means the person will be showing flexion of all the toes, flexion plus normal flexion plus plantar flexion of the foot plus flexion of all the toes. Okay, so from here, what we understand is the human lesion, because of this neuronal lesion, the corticospinal tract is affected. So from spinal cord to higher center, there is no connection which is to carry over the, from the cortex region to spinal cord, there is nothing to carry over the same impulses from the brain to the spinal cord. So that there is no connectivity. Because of that, there will be exaggeration. So that only we are getting extension of grade toe and fanning out of digits. Okay, but in LMN, there is no connection from the food to the spinal cord so that we are getting absence or minimal response from the food. But in normal people, nothing is affected, so we get good response, which is normal flexion of all the tools. Right? Thank you.